Welcome to part 2 of jaundice in newborns. In this video, we are going to discuss or to focus on risk factors of developing severe jaundice in newborns, complications of severe jaundice in newborns, and treatment of severe jaundice in newborns. For you to understand this video better, watch part 1 of this video in my YouTube channel. If you like this video and benefit from it, hit the like button, share, comment below, and subscribe. What is jaundice in newborns? Jaundice in newborns is the yellow colorations of the eyes and the skin of the newborn baby. There are two types of jaundice. Jaundice can be physiological or pathological. Physiological jaundice occurs in day 2 to day 3 of life and can continue up to 1 to 2 weeks. Pathological jaundice occur within the first 24 hours of life and can continue beyond 1 to 2 weeks. What are the risk factors of developing severe jaundice for newborns? 1. If the previous newborn developed jaundice. Number 2, if there is a family history of jaundice, maybe a family member has ever developed jaundice. Number 3, if there is a family history of hemolytic anemia. Hemolytic anemia include sickle cell anemia. Number 4, if the mother developed certain infections during pregnancy. These infections are many. One of them is toxoplasmosis. There are so many of them. Number 4, if the mother was taking herbal drugs during pregnancy. Herbal drugs, some of them can destroy the liver of the newborn, resulting to newborn jaundice. Number 6, if the newborn is blood group A or AB or B rhesus positive and the mother blood group is O rhesus negative, this one will result to jaundice in newborns because the mother's blood, the immunity of the mother will fight the blood of the newborn, resulting to jaundice in newborn. If the newborn has sustained birth injuries, example of birth injuries that a newborn can sustain is cephalohematoma. Cephalohematoma is accumulation of blood clot under the skin of the newborn's head. This occurs because of pressure. When the baby is being delivered, pressure can accumulate around the head of the fetus, resulting to rupture of the small blood vessels. Sometimes the pelvis can cause that pressure. And the last, if the newborn develop a problem in breastfeeding. A problem in breastfeeding can occur in case the mother does not have sufficient milk, or the baby has a problem in sucking, or the mother has painful nipples, or maybe there is a poor positioning during breastfeeding. What are the complications of jaundice in newborns? Complications of jaundice in newborns can occur if the levels of bilirubin is high. We say that bilirubin is the component that causes that yellow color in the eyes and in the skin. Bilirubin is a byproduct of red blood cell. When red blood cells are broken down, they give a byproduct we call bilirubin. This bilirubin is very toxic and can go to the brain of the newborn, and it usually can cause brain damage. Complications can be prevented if the mothers are educated before they are discharged from the hospital. This will help the mother detect jaundice early and take a quick decision to bring the newborn to the hospital. There is also a smartphone application that usually has been developed to detect jaundice for those people who cannot be able to detect jaundice well. One of the complications of high levels of bilirubin is acute bilirubin encephalopathy. This is when the bilirubin crosses the blood-brain barrier. There is a barrier between the brain and the blood vessels in everyone's head. In a newborn's head, this barrier is not completely mature, so bilirubin can be able to cross over to the side of the brain, damaging some of the parts of the brain, including basal ganglia. Basal ganglia is that part of the brain that can result to that moderate movement. If the damage is permanent, we have another complication we call canicterus. Acute bilirubin encephalopathy is a temporary and can be reversed if treated early. A child who has developed acute bilirubin encephalopathy will develop poor sucking, lethargy is a child become very inactive and not doing anything or just sleeping. The baby will also have increased sleepiness. The baby will be irritable. The baby will have a high-pitched cry, and also the baby might develop hypertonia or hypotonia. Hypotonia is loss of muscle tone, so the muscles become weak. Hypertonia is when the muscles become very stiff. The worst complication is when we have a permanent damage of the brain. This permanent damage of the brain, we have said it's called canicterus. Canicterus will manifest as cerebral palsy. Cerebral palsy is a condition where the baby is born and the baby has inability to walk, sit, stand, to hear. Also they have inability to talk, and also the eyes are always gazing upward. Canicterus it's not reversible, so it's a serious complication. That's why we advocate for you as a mother to notice jaundice early and to take the appropriate action. Treatment of jaundice depends with the severity of jaundice. One, we have the baby need to be tested for blood. There are several tests we usually done. We have a full hemogram. Hii ndio ukienda hospitali unaambiwa damu itaangaliwa yote. Number 2, we have a test where we check the levels of the bilirubin in the blood. Treatment 1 is phototherapy. Phototherapy, your baby will be admitted in a hospital and also will be taken where there is a special lighting. This lighting is called phototherapy. It includes blue or green light emission. This light helps to convert the bilirubin into lamirubin, which is easily excreted by the liver. Number 2, we have what we call tin propofurine. Tin propofurine is a treatment that prevents the breakdown of the hemoglobin to bilirubin. Number 3, we have exchange transfusion. Exchange transfusion is when we transfuse the baby with another blood. This is done by removing the baby's blood and transfusing another blood. Follow and subscribe for Dog for more content like this. Thank you.